extensive anastomosis between the right and left coronary arteries developed during the embryonic period. Anastomotic channels expand in the presence of coronary artery occlusive disease. And sometimes we can see spectacular collateral pathways within a system, which is called homocollateral, or between the two systems, which are called intercollateral circulation. There are anastomosis by inosculation, which is telescoping between branches of the two systems. And this we can see particularly at the level of the distal portion of the left anterior descending branch of the left coronary artery and the terminal portion of the posterior descending coronary artery. The connections between the two systems can occur in the epicardial and or in the intramural portions of the heart. We can see them in the ventral, in the dorsal, in the superior and in the inferior portions of the heart, as well as in the atrial and or ventricular regions. We are going to show you examples of intercollateral circulation at the level of the outflow tract of the right ventricle, the ventral aspect of the circle of Vieuxens. We are going to show you also collaterals at the level of the interventricular septum and anastomosis by inosculation. Slow obstructive lesions of the coronary arteries and exercise, particularly of the aerobic type, may expand these connections, which they will then increase in size and or number. We're going to show you now a radiograph of a specimen where the right and left coronary arteries were injected with diluted barium. We can see the abundant number of vessels which are not depicted at the time of coronary angiography because of the limitations in the total volume of contrast that is injected into the coronary arteries. We can see that there is a crisscrossing of vessels from the right to the left system. In the next two images, we see close-ups of casts of the right coronary arterial system depicted in red and of the left system depicted in blue. We can see that at the origin of the coronary arteries and in the distal part of the heart is where we can appreciate the interconnected vessels between the two systems. The circle of Vieuxens is an anastomotic pathway that is seen at the origin of the coronary arteries. In this anatomical specimen, we can see anastomosis by inosculation between the right and the left coronal arteries. The red telescopes with the blue in the surface of the outflow tract of the right ventricle. This constitutes the anterior aspect of the circle of Vieuxens. In this coronary angiogram, in the left posterior oblique projection, there was an irregular stenosis of the right coronary artery indicated by the arrows with ulcerated plaque. We can see the filling of the left anterior descending coronary artery in an antegrade fashion. And this comes from a large right coronal artery that connects directly with the left coronal artery and from there to the left anterior descending branch of the left coronary artery. This is to show the potential collateral pathways at the origin of the coronary arteries. These are photographs of the same specimen where the cavity of the ventricle was injected in blue. The right coronary artery is seen in red and the left coronary arteries in white. In this cast corrosion preparation, where the ventricles are in blue, the right coronary artery in red, and the left coronary artery in white, we can see the right coronary artery coursing in the right atrioventricular groove. Note that it gives off the first branch from its superior aspect, which is directed cephalically, and that is the sinoatrial branch. In this next photograph, we have taken a picture of the root of the heart. The ventral aspect is in the top of the image, and the dorsal aspect is in the bottom of the image. The right coronary artery seen crossing from left to right, covered in part by the right auricular appendage. Note the sinoatrial branch, which is directed dorsally and cephalically. The same specimen photographed from behind shows the termination of the left coronary arterial tree in the posterior atrioventricular groove and the branches of the right coronary artery in the region of the crus of the heart. This dorsal aspect of the heart is where anastomotic channels complete the circle of Vieuxens that surround the root of the major arteries. In this last photograph of the same specimen, we can see a cross-section of the aorta and of the pulmonary trunk. Ventral to the aorta, we see the right coronary artery coursing the atrioventricular groove. And dorsal to the aorta, we see terminal branches of the circumflex coronary artery. This portion of the vessel gives also branches to the sinoatrial node, which is usually protected by the two circulations, because this is the cardiac pacemaker, a very important structure that commands the electrophysiological function of the heart and must secure its blood supply, which normally comes from the right, but also is supplied by the left system. Again, surrounding the aorta, wrapping around the root of the aorta and of the pulmonary trunk is the circle of Vieuxans, of arteries coming from the two systems, connecting ventral to the aorta and dorsal to the aorta. In this patient with extensive arteriosclerotic disease, note obstruction of many major arteries and variations in lumen diameter with extensive collateral circulation. There is a large atrial circumflex branch that is directed dorsally and connects with the sinoatrial nodal artery, which is the first branch of the right coronary artery. These are indicated by the open arrow. And it is of interest to note that the sinoatrial artery arises from the common circumflex coronary artery. Again, this will be the dorsal aspect of the circle of Vieuxans. Inter- and homocollateral circulation is noted in this angiogram. In the next two images of the circle of Vieuxans, we can see the curving of arteries around the aorta. This was a selective right coronary arteriogram, which shows the sinoatrial nodal artery coursing dorsally and cephalically, and then from right to left to anastomose with branches of the circumflex. And finally, another oblique view reveals the sinoatrial branch of the right coronary artery, connecting with the branches of the left circumflex behind the aorta, the complete circle of Vieuxans. These next angiograms reveal abundant intercoronary collateral circulation. The right coronary artery was injected in this patient, and one can see that through the septal branches of the posterior descending branch, which is a continuation of the right, there is a connection with septal branches of the left anterior descending, which fills in a retrograde and then in an antegrade fashion. Retrogradely, it stops close to its origin because this patient had a complete occlusion of the left coronary artery. The major collateral pathways were through the septum of the ventricle. In this next right posterior oblique coronary angiogram, we can see again that septal branches of the right coronary artery fill the distal portion of the left anterior descending. And also we can see that beyond the crus of the heart, we can see a connection with the circumflex coronary artery, which also fills in a retrograde fashion. In this last coronary angiogram, in the left posterior oblique projection, we see anastomosis by inosculation, which means the telescoping of the distal portion of the posterior descending coronary artery with the distal portion of the left anterior descending coronary artery. This patient had a total occlusion of the left anterior descending coronary artery.